It is Self-Love Monday, and tonight we're talking about something that affects millions of women, often silently. This is HPV. Human papilloma virus. It's the leading cause of cervical cancer, yet it's also one of the most preventable with the right information, with vaccine, and with regular screening. Now, to guide us through this important conversation, we are joined by Dr. Pearl Mashoene, who is a specialist obstetrician as well as a gynecologist who serves women across the East Rand through practice. This is Flora Gynae in Benoni. She's passionate about creating safe, empowering spaces for women to take control of their health. And tonight, she's here to help us do exactly that. Dr. Mashoene, thank you so much for joining us. Welcome to African Diaries.
Thank you so much, Sheila, for having me.
You know, doctor, I was doing some research on HPV, and then I saw that there are over 100 types. I said, whoa. Let's just start there by giving context. What is HPV?
Okay, so HPV, like you already just mentioned, it's a human papilloma virus, and transmission of HPV is by skin-to-skin contact, and most commonly through sexual intercourse. And the main problem with HPV is there's so many strains, like you just mentioned, but of all the strains that are available, there's particular high-risk ones that predisposes women from developing cancer. So that's the biggest concern as far as HPV is concerned.
Now, doctor, I also learned that these cancers are not limited to your cervical cancer. I heard that your throat, your anus can be infected. Please give us context. Why are these specific areas?
Yeah, absolutely. So like I said, because it's skin-to-skin contact, so this also includes oral sexual intercourse. So by having oral sex, you essentially also can expose yourself to HPV in your oral tract, which can subsequently also lead you to having oral cancer. And yes, I know many women think HPV is only limited to the cervix, but it's other organs that can also include your external genitalia, like your vulva, your vagina, and not only women as well, in men as well, they can also get penile cancers as well. So it causes quite generally focused multiple involvement of many other organs.
Sure, doctor. I think to put us at ease, we also know that it is preventable. It is, to an extent, this can be dealt with. And I think we're going to get to that towards the latter end of our conversation. Let's talk about symptoms. Somebody who's saying, what is HPV? How am I supposed to know that this is potentially looming in my body?
And I think that's actually the biggest thing with HPV. Before symptoms occur, Sheila, it can take many years, up to 10 to 20 years before you start seeing symptoms. So what HPV does, it affects the cells at whichever organ is involved, and then ultimately over many periods, it changes the lining of your organs into abnormal cells. And then again, over time, those abnormal cells change into precancerous cells, and that's where the goal of screening is targeted as in picking those abnormal cells, because if you don't pick up those abnormal cells at that stage, then the next thing is progression into cancer cells. And then symptoms vary depending on which organ is involved. So obviously, if by the time you have symptoms of HPV, it means you've well advanced in the change of cells, cellular stage. So most common symptoms, depending on where the organ is, so I'll talk about with cervical involvement. So if there's cervical involvement, if the type of high-risk HPV that you have changed your cells into abnormal cancer cells, and essentially you add your cancer stage, depending on what stage of the cancer that you're in, you'll have abnormal, foul-smelling PV discharge. And what it does is essentially, in layman terms, it eats up your cervix. So your cervix will start rotting away. You'll start getting abnormal tissue coming out, very foul smelling. then it also depends. If you've got the other HPV that are not cancerous, they can cause changes of your cells that will result into, the most commonly is your genital warts. So they may start as flat like lesions on your genitalia, and eventually, depending on how severe it is, they grow into big lesions. But like I said, by the time you start seeing symptoms, it's already, half the time it's already advanced. So that's why it's important, especially for us, to catch women by picking the strains of the HPV by their DNA testing or by their pap smear way before progressions into symptoms.
Yeah. And doctor, is there any pain involved?
Not always. So pain, again, if you have pain, it's only in the advanced stages. Once you're in the advanced stages, you'll start having irregular bleeding. You'll have intermenstrual bleeding, which is abnormal, sometimes associated with some brown discharge. And if there's already cancerous lesion at the cervix, those are the ones that will cause pain, but it's not always painful. So essentially, it's a silent disease over a long period of time before it progresses into symptoms that are quite significant. So that's why half the time, if you're already coming in symptoms, it's already advanced.
Sure. The voice there of Dr. Pearl Mashoene joining us this evening, specialist obstetrician as well as gynecologist. The conversation at hand, HPV. And I'll have you know that it doesn't just affect women, it affects men. So if you're a man and you say, yeah, that's not for me, please sit down. You need to listen to this one as well. Do find us on WhatsApp. Send through your questions, +27 83 288 6684.
Africa Speaks on African Diaries with Shayla Ndikumana.
42 minutes after 10 p.m. Central Africa time. If you've just joined us, thank you so much for choosing us over the rest. Welcome to Channel Africa's African Diaries. And we are still in conversation with Dr. Pearl Mashoene, who is a specialist obstetrician as well as a gynecologist. And she's, of course, behind the practice Flora Gynae in Benoni, that is in the East Rand in Johannesburg, South Africa. We're talking HPV, human papilloma virus, and we try to understand this particular virus and how it affects the body. Something that I thought was interesting to note is that it affects both men and women. With that being said, Doctor, there's a question coming from the floor in the studio. Who are the main carriers of HPV, women or men?
Okay, so girls and women carry the highest burden of HPV-related diseases, and compared to men. And I think the commonest thing is because men mostly they don't have their external genitalia is more on the outside. So women internal genitalia is connected to the external genitalia. So there's many areas that can be involved in women. So it includes cervical, vulval, vaginal, and they can also extend perianally as well.
That is fair. That is fair, Doctor. I think you've brought some level of peace right here in the studio. Let's continue the conversation. I want to talk about preventative measures. Is there a point where someone can say it's too late? Does it ever get to that stage? I know that the minute cells start to become cancerous, we should be on red alert. However, is there such a thing as we can't go past this? As in, we are now, I suppose, we're taking the consequence of this particular virus in our body and we can't reverse its cause.
Sheila, the good news is women can continue to vaccinate even after they've been exposed to HPV. So part of the primary screening, as much as it's mostly focused on the young girls between age of 9 to 14, but women are still able to get vaccinated against HPV. And the benefits for those women is, for women that have been exposed, it reduces the chances of those abnormal cells that are already there progressing into cancer cells. And again, it also reduces the chances of them getting reinfected in the futures. And I mean, it doesn't necessarily mean that all women are exposed to HPV. Some might be older but never been exposed to HPV. So those women will also still benefit from vaccination. So I know it's the biggest myth that once you've been exposed or you're older, there's no need to vaccinate. Yes, women can continue to vaccinate even after being exposed to HPV.
With that being said, doctor, there are a lot of, I suppose, there's a lot of fear as well as misinformation, disinformation when it comes to HPV. Let's address some of those myths. What are things that you have seen your clients, your patients believe that aren't necessarily true?
I think the biggest myth is as far as vaccinations are concerned. So a lot of people believe that when you get vaccinated, they inject the virus into your body, therefore exposing you to that virus. So it's important to know that the most vaccinations is not the actual live virus that are in the vaccine, which is the same for HPV. It's a dead virus. It's just exposing your body to be able to fight the actual virus. So that's the most important myth.
You know, doctor, maybe we can take this moment to understand how vaccines work, right? Just generally speaking. As though you're explaining to a 6-year-old, what does a vaccine do? Because I hear that a lot. I hear people saying they're injecting you with the actual virus, and therefore if you have symptoms of that sickness and you never heal, and I'm referencing COVID for the most part. I remember people saying my lungs don't work as well ever since I got this. And so for those who are trying to understand how vaccines work, let's walk through it together.
Okay, so the benefit of vaccination essentially is to expose your body to this foreign virus, but obviously, if it's a vaccine, it's not the actual virus, to allow your body to fight it and develop antibodies so that when you get the actual virus, your body is strong enough now with those antibodies to be able to fight off that virus. So that's really the important thing. We are exposing your body to allow your body to develop antibodies that will be strong enough to fight that virus should you be exposed by that actual virus.
And doctor, for those who are thinking which test between a pap smear and an HPV test is more thorough, what would you say to them?
Okay, so that's a good question. So back then, before technology involved, our only screening method was the pap smear. So the comparison between pap smear and HPV DNA testing. So the pap smear is only specific in picking up the abnormal cells that are already there. But the benefit of HPV DNA testing, which is what we are doing now, is it actually picks up the strains of HPV way before they can even causes abnormal cells. So we're able to detect that a woman has this high risk HPV, she has been exposed, and be able to take the necessary steps to look at the mouth of the cervix to see if those cells are already there, and we remove them. So that's the biggest benefit comparing HPV to the pap smear. But it's also important to know that together the HPV vaccine and pap smear provide better diagnosis for us as well. So there's different triaging steps that we go through with testing. We'll do your HPV DNA test, and depending on the results, then the next step will be I'll help us decide if we're going straight to look with a colposcopy, which is the microscope, machine in layman terms, to look at the mouth of the cervix to see where those abnormal cells are there, if they are there, and we remove them or biopsy them. But if you have a high risk HPV, the other thing that we can do is also do the pap smear, look to see especially if those abnormal cells are there or not. So there's a different triaging system depending on a patient's risk profile, patient's age. But the important thing is the HPV is highly sensitive in picking up this high-risk HPV as compared to pap smear that only picks up those abnormal cells that are already there. And that's not what we want. We want to pick up that high-risk HPV way before already it gets into abnormal pap smear. Then the next thing is the benefit of HPV DNA is Once you've done the HPV DNA and turns out that it's normal, you don't have high risk HPV, it gives you a longer interval in testing again. So the next time you need to test again is in 5 years, as compared to pap smear. Then the next time you need to test is 3 years. And we know in most of middle income and low and middle income countries, patients don't have the money or the funds or the time really to test every often. So that's the benefit.
The voice there of Dr. Pearl Mashoene joining us this evening, specialist obstetrician as well as gynecologist, and we're discussing HPV. 10 minutes before 11 p.m. Central Africa time. I do see your questions rolling in. We'll attend to them in just a short bit. For now, let's take a quick breather.
Across Africa, communities rise with the promise of clean water and clean sanitation. The African Union's 2026 theme calls us to action.
It's about mobilizing real commitments, securing climate-resilient water and sanitation projects, and ensuring that water becomes a driver of sustainable development and prosperity across the continent.
A landmark moment, not only for Africa, but for the global movement for access to safe water for all.
Assuring sustainable water availability for every home, every village, every nation. This is the Africa we want.
Channel Africa, the African perspective.
Your life, your rhythm, your Africa. Channel Africa. Find it for free on Google Play and the Apple App Store. 6 decades strong, Channel Africa continues to inspire Africa and the world, proudly sharing
the African perspective.
From Cape to Cairo, every beat tells a story. It's African Diaries on Channel Africa.
It is 8 minutes before 11 p.m. Central Africa time. We are still in conversation with Dr. Pearl Mashoene, who is a specialist obstetrician as well as gynecologist, and we're discussing HPV, human papilloma virus, and essentially how it affects the body, treatment plans to an extent. We're looking at vaccination. We are looking at preventative measures, which I think we'll touch on toward the end. Doctor, a few questions are coming in. The very first saying there's a concern about being tested as a false positive regarding HPV, more especially because you took the vaccine. Is that possible? And if so, how does one mitigate that?
So, no, that's so if you've had vaccination against HPV, it prevents some strains of HPV, but not all the strains. So when HPV test is being done, it's sensitive in picking up the actual HPV subtypes. So it might not pick up the high-risk ones that you've been vaccinated against, but it might still pick up other types of HPV, which don't have a higher rate of causing cancer, but they are still relevant and may still cause cancer. So it's unlikely that you get a false rate after being vaccinated against HPV. And that's why then women after being vaccinated against HPV, they still have to continue to screen, because screening and vaccination provide maximum protection against HPV. So being vaccinated does not mean that you are immune from HPV. There's still other strains of HPV that you might be exposed to. So that's why you will still continue to screen against, even after having been vaccinated.
Yeah. And then there is a question that steers us off away. So I think I'll ask that toward the end. That question, a question by Dazzy coming in. The one just before that was by Bovi Deep. Doctor, let's talk about preventative measures. Yeah, because I'm hearing a lot of testing, AIDS happening all at the same time. But how do we have this not happen to us? What are these preventative measures?
Okay, so obviously prevention goes back to how do we contact HPV in the first place. So like I said, HPV contact is through skin to skin contact, and obviously the commonest route being sexual intercourse. So part of primary infection prevention includes safe sexual practices, okay, by reducing exposure to HPV. So for us, women and men, it means we need to sit down and have open conversation about safe sexual practices, and especially encouraging monogamy in relationships, and practicing safe sex by using condoms. So essentially, the important thing is safe sexual practices.
And then, Doctor, as a parting shot, and this is a question by Dazzy at 23, and this steers us away, but it is within your frame of practice. What causes fibroids?
Okay, all right. Sure, that's essentially another topic on its own.
Absolutely.
But to just give them just the background, we don't know, even as a scientist, the exact cause of fibroids. Many studies have been done. We cannot identify the exact cause of fibroids, which is why it is difficult to prevent fibroids. All we know is that it's common, especially in Black females, women of Asian descent. There is some genetic predisposition as well. So that's all we know. We don't know exactly on scientific level what causes fibroids, and that's why there's no prevention for fibroids.
Doctor, it feels like the woman's body is a mystery. Am I the one who's misled?
No, it is. It is. It is.
Beautiful, but very mysterious.
Very. Absolutely. Absolutely.
Sure. Yeah, no, there's another comment coming in here saying that maybe women must just consider taking out their wombs, but I don't think that that's the solution, right?
Not at all. Not at all. And I also just want to mention something, Sheila. Yes, I mentioned that HPV is transmitted skin to skin contact. One of the risk factors is reducing transmission is safe sexual practices. But I just need to make it clear that we all need to know that HPV is common. And even if you've had one sexual partner in your life, you are still at risk of having HPV. And the other important thing is you cannot say for sure at which point of your sexual reproductive life when exactly you were exposed to HPV. So please, it's important for women to also realize that, and not after being diagnosed with HPV and go back home to their partners and say, you infected me of HPV. So it's also, yes, because those are also other things that are also limiting women seeking help earlier, because they don't want to be seen as having been promiscuous. So anyone can be exposed to HPV. Even I myself, I often tell my patients that even I can be exposed to HPV, even Mam Fundisi can be exposed to HPV. So all women are at risk of HPV transmission. That's why we encourage that all women go to screen for HPV.
Doctor, what a beautiful way to end the conversation. Thank you so much for joining us. This has been very fruitful.
Thank you so much, Sheila. Have a lovely evening.
Likewise, the voice there of specialist obstetrician and gynecologist, that is Dr. Pearl Mashoene, joining us this evening. 2 minutes before the new hour, if you're saying to yourself, Shayla, I'm a gentleman, I don't know how I may have been exposed, the question is not how. It's essentially go get checked. Do an HPV test. Okay, this is a DNA test that proves to be far more accurate than what women would have an option to, which is a pap smear. And so go get checked every 3 years for women who are going to be doing a pap smear, and every 5 years for everyone who's going to be taking that HPV test. There are vaccines, there are solutions to this particular virus. So please do not despair. Do not think it's the end of the world. And I think Doctor emphasized that toward the end of the conversation. A few seconds before top of the hour, if you've just joined us, hello, welcome to African Diaries.